everyone, welcome back to the Student Arts Network. I have one of my producers, Diana, with me today. We are very excited to have the opportunity to interview the one and only Millennial RX. I'm sure a lot of you guys have seen him before on various platforms. For those who miss out on the fun, Dr. Melillo is a well-known pharmacy content creator on TikTok and Instagram. He's also a pharmacist who specializes in dermatology and skincare and integrated health at L'Oreal. First of all, it was great to get to meet you in person at the past ASHU mid-year, Dr. Melillo.
Yeah, no, it was great to meet you as well, and thank you so much for having me on today.
Yeah, again, it's from the content that you created, it's always inspirational for many pharmacy students out there to just see your content and see how much of an impact that has made to their career. And I'm just really glad to be having a chance to interview you today. So let's start off by moving on with the question. Diana, would you mind starting first?
Perfect. Yeah. So, as we know, would you mind describing a little bit about your pharmacy journey today?
Yeah, sure. So I can kind of just start off kind of how I came to be at L'Oreal. So for me, after I finished pharmacy school, so I graduated back in 2017 at the University of Rhode Island. After that, I moved over onto, I did a residency. So I did a PGY1 with Walgreens Specialty in the University of Houston over in Houston, Texas. So I worked in like the Texas Medical Center, primarily doing like solid organ transplant, which I loved it. It was definitely a very interesting and unique kind of career that a pharmacist could go into. And then I also taught at the University of Houston as well. So pretty much I did just 1 year residency. And then afterwards, I stayed in Houston for about like a year or two. And then I moved over into working for Walgreens Specialty as like a pharmacy manager, primarily like in Hep C and HIV. So I moved back home to Rhode Island to do that. And then after that, I then switched over to working PBM. So I worked at Magellan, which is now owned by Prime Therapeutics. So I did a lot of like talking to patients, talking to doctors over the phone. It was like remote. Definitely a very nice job. Um, and then afterwards, I moved over into ambulatory care. So I'm a certified diabetes outpatient educator. So during that time, through like a collaborative practice agreement, I was able to prescribe, titrate, pretty much manage everything diabetes specific for patients under a provider. So which was awesome. And then during the time while I was working at Magellan and also as an ambulatory care pharmacist, I was posting on TikTok, just because I saw like there was such like a I feel like there was just no pharmacy presence on there. Like I kept seeing dermatologists, I kept seeing nurses, and they were doing great stuff, but there was no really mention of pharmacists or honestly, like I really didn't see anyone on there. So I started just posting and I did my first, it was like, yeah, my first video and it went over 1 million views. And kind of just grew a following from there. And I just kept posting and posting. And then through that, I've been very lucky and fortunate to do like a lot of brand deals. And one of them was actually with CeraVe, which is a company that's owned by L'Oreal. And so when a position had opened up on the integrated health team to work with CeraVe and La Roche-Posay, I applied for it because it was for a pharmacist role to really talk to pharmacists, pharmacy students, pharmacy technicians to educate about skincare, just because there's such like a knowledge like deficit in pharmacy school because you get, and I'm sure you can agree, you probably got like maybe 1 or 2 lectures on it, if that. And so I've been able to really use like my social media background, but also my clinical background to really help educate pharmacists and students and technicians in the skincare space.
Yeah, that sounds great. I didn't realize that there was such a long journey before reaching or ultimately ending up in skincare. And it's great to see that you have so much vast experience and you want to share these experience from the work kind of environment you were at before in reflecting of your social media presence today. Another question that we have is that what is your practice like, or what is kind of your day-to-day routine? I know it might get a little bit different, per maybe per week or per month, but or how do you first get interested into maybe looking into the field that you're currently working at?
Yeah, so for me, the way I got really interested into dermatology was It was honestly social media. So that was actually one of the first brands I worked with, was Murad, which is like a skincare brand. And so I was able to, it made me realize that, wow, this is like a space that there's really no pharmacy influencer actually talking about skincare, but yet we're like healthcare providers that are literally the closest point of sale to skincare. And so it just makes sense to like want to educate pharmacists and students and technicians about skincare. So yeah, so I was really lucky to be able to start doing that. And so going into kind of my day to day, it definitely varies. But I can tell you kind of what like I'm like the lead in my in my role. So I work primarily to help promote like oncology, especially for like dermatology, just because with oncology, a lot of patients, and I'm sure when you learn about this like in pharmacy school, with a lot of chemotherapy, radiation, skin side effects are a really common side effect. It occurs almost, it's like, and I know it's like over like 50% of people, it's probably even higher than that, have some sort of like skin side effect. And so like with La Roche-Posay, like their Lipicar line, their products, they've been actually been used in patients in chemotherapy and radiation. So it's like such a huge, it's really a passion of mine as well, just because I've had like my grandfather passed away from pancreatic cancer. So just to be able to help patients during that time when it's pretty scary, and the last thing you want to do is like have a side effect from a medication that's supposed to help cure your cancer. And so I work on that. And then I also work in the digital side. So I work at so on Instagram, we have like pretty much a dedicated space for pharmacy professionals called like the L'Oreal Pharmacy Corner. And through that, like that's one of my passions, is like I'm able to like have giveaways and pretty much give free stuff and free products and information to pharmacists, students, and technicians just for them, which is really awesome because I don't think any other company does like giveaways just for our profession. So I've been really like passionate about that, just because like for example, like companies, like Lululemon, like they always have these healthcare discounts and we're never considered in any of them. So I want to really try to make sure that we're in the forefront of that, through being the digital lead here. And then I also work with like students. So like with pharmacy students, I talk and guest speak at like a lot of pharmacy organizations, really just to kind of educate them about skincare, but also about like CeraVe, about La Roche-Posay, because I could just talk about any type of skincare brand, but like kind of specifically, why are these like clinically, medically recommended? Like, what's the background? What's the clinical trials that we've actually done to prove why, for example, CeraVe is like the number one pharmacist recommended brand? So there's a lot of data that we have that I love to share with pharmacy students. And then I work on the trade media. So anything that you see in like a pharmacy publication, so like Pharmacy Times, for example, it's gone through my eyes. I've looked at it. I've worked with a creative team to make sure that the message is really tailored to the pharmacy profession. So I work on that, and then just as well as conferences. So right this year we're going to over 40 like conferences in the region. So you saw me at ASHP. I'll be at APHA, and so there's a ton of conferences. We have a lot of people who will be going to them, and so I try to go to as many as I possibly can, and that's just a great way to connect the pharmacist one on one. So I think I love my job, and I think it's amazing because the purpose of my job is to really work directly with pharmacists, technicians, and students to really just help increase their education about skincare and really about like the brand CeraVe and La Roche-Posay. So I'm very fortunate.
Yeah, and I shall see you again at APHA Orlando.
Awesome.
Yeah.
It'll be good to see you in person again.
All right. Great. Diana, do you have anything to add on?
Yeah, thank you so much for explaining all that. That is amazing. I'm also like a skincare fiend. I'm getting into skincare currently, and I love using CeraVe products. So, seeing how even a pharmacist can work in a role like that, that's just amazing. So, switching gears to social media. When did you start your social media career, and how did it go viral, and how was it getting into the world of social media?
Yeah, so social media. So I was really behind in it. Like looking back, I wish I had started like during COVID when everyone was just at home going on TikTok. My fiance, she was on it, but I was not. I was kind of like trying to avoid the whole social media. If anything, I forgot that I don't know if you guys had saw that Netflix documentary about like the social media and everything, and like how like they track stuff. So I was at the point of trying to get rid of all my social media. And so then just one day I was like, you know what, I'm just gonna do it. So it was in March of 2021. So this March it'll be 3 years since I've started social media. So fairly like not that recent. I mean, I feel like pretty recent, like not I haven't been around doing it for that long. And so I just did one video. It was about medications that interact with alcohol, and it was just me like pointing at certain medications, and that video like went viral, went over a million views for that. And so from that, I think in like my first week or so, I got like 20,000 followers on TikTok. So I just kept posting and posting about pharmacy stuff. And I realized like there's really no one talking about the profession. There's no one, no, and the public doesn't really know about what pharmacists do. They just think a lot of times we get you just fill pills at the back of pharmacy, which we do so much more than that. And that's really why I'm like, it's become more of a, not like a hobby anymore. It's more like a passion that like I realize the kind of platform I have that about the profession, I'm able to speak about exactly what the profession can do. And really, I hopefully I'm shining like a good light, like a positive light on our profession with like the videos that I do. But yeah, it's been crazy just how much it's like it's grown. It's to the point now I have a media team who like with when it comes to brands like to deal with all that just because I really want to focus on the content and what I'm producing for my audience.
Sounds amazing. Being able to, just step on the foot on social media and represent pharmacy in that way is always very special. And, from myself, I, started doing social media even before as a pharmacy student, as a pre-pharmacy student, in fact. And I see like, definitely a need and a gap that can be filled in these spaces. And I'm just so glad you was able to exploit that and get to thrive in that space along the way. So
Yeah, no, thank you.
yeah. Next question we also have is kind of also related to social media. Um, just kind of serve as a kind of a follow up in regard to the impact of social media on the practice of pharmacy, and public's image to pharmacy as a profession. I know you mentioned a little bit, the public's understanding of us as a pharmacist, maybe just like filling pills behind the counter, or sometimes they would talk to you, sometimes they give you your vaccines that could become more prevalent during the COVID-19 pandemic. And by what you do on a social media basis, how do you think, you know, your content have made that impact is tell the public, say, hey, pharmacist is not just that, we have so much more we can do.
Yeah, so I think really what I've tried to show through my videos is not only do we, we're working with patients directly, but just like clinically, like we know so much and we're such an underutilized profession. And so I've been lucky enough to, through social media, be able to connect with doctors, be able to connect with nurses, PAs, nurse practitioners about and them not them even them being surprised of how much pharmacists know and how we're able to really help that even make their job a lot easier. And I think another thing I've been trying to really do is try to showcase other areas of pharmacy. So I've showcased there was like a nuclear pharmacist who I saw a video, so I wanted to push that out. Hospital pharmacy, industry, which I guess that's what I'm considered now, which I don't think of it as, but I guess that's what it would be, the best it would be described as. But then even retail as well, because just to show like we know a lot about the medications, and just to also show kind of what happens behind in the pharmacy, because it's more than just we're filling pills and we're giving it to you. It's more like we're checking your insurance, we're checking formularies, calling the insurance to see what's going on. But then also if the doctor writes a prescription that's written wrong, not what you're supposed to be on, you're allergic to it, there's a drug interaction that you're not aware of. And I think patients get annoyed at the farm, like, and I've seen this in comments, like they get annoyed that why is my prescription taking over 15 minutes, or why is it taking over 30 minutes? And I think they don't realize, one, that there's probably 10 to 20 people ahead of them, even though it doesn't look like it, but that is usually the case. But two, like it could just take one prescription to delay you like 15, 20 minutes, because you're trying to put the patient's health first. So because if something happens to you, and that's another thing they don't realize, it comes on the pharmacist. It doesn't come on the pharmacy. It comes on your license, and you can possibly lose your license. And so I really try to emphasize like the risk that pharmacists take every day by working at a pharmacy, by really, that's why they have to be so careful with what they do. And so, yeah, so I really hope I've been able to showcase that through my TikTok and social media.
Yeah, for sure. Because I believe, I personally always appreciate your content staying true to the profession and not fear from straying away from, things that might not sound as positive, but it's important to reflect upon. And, there are existing concerns about pharmacy from the public with, negative news of, like, let's just say there's a significant medication error, or, or the public's reflection on why can't I get my prescription? Why is it not covered? Why are you charging me that much? Why is a PA required? All these kind of concerns, and how your content can provide better insight into the perspective of a pharmacist, and how pharmacists actually serve as an advocate for the patient instead of going against the patient's will. I believe a lot of us got into this profession just with a idea because I want to help patients. I want to serve as the medication expert to teach patients how to use their medications and help them to access them appropriately. And I also appreciate that you mentioned about you connecting with different doctors and nurses. That really shows like the importance of interprofessional like collaboration within the healthcare, right? There's just so many things that we can look into in that perspective, and how pharmacists can be part of the healthcare team. I was just wondering, do you have some sort of experience like that at L'Oreal right now?
So yeah, so with dermatologists. So definitely, I've been so fortunate to really connect with a lot of just like popular social media. So if you've met like, Dr. Shaw, I've met him in person, Dr. Portella, just to name a couple. So it's been really awesome to meet people who like I look up to as like big social media people. But also as well as just honestly dermatologists in general has been really nice to get to meet them, to be able to see like what their perspective is of pharmacy, how they've interacted with pharmacists before. And so yeah, it's awesome to be able to meet them.
Yeah, that's great. Diana, would you like to wrap things up?
Yeah. So to wrap up, do you have any advice for current pharmacy students, or any recent graduates, or anybody who just wants to get into pharmacy in general?
Yeah, so definitely. So I guess my best advice for anyone who's interested in pharmacy, I think that if you want to do pharmacy, you really have to have a passion. You have to be able to want to help people. Sometimes it's going to be like a selfless, like not everyone's going to thank you for what you're doing. And so also as well with medications, like if you're really interested with how medications like pharmacologically work in your body, that's like a huge thing as well. And then for pharmacy students, the one thing I always couple things, try to be as active as you can, because that's such a huge thing with like clubs, organizations, because especially the next thing which I'm going to like recommend is doing a residency or a fellowship, because when you're doing that, when you're doing interview, I've interviewed as a residency preceptor. What they're looking for is to see, how often like how many clubs were you a part of, like what leadership opportunities did you have. And I think just given the state of pharmacy right now, I think that it would be a huge miss if you don't do a residency or a fellowship, just to really boost your resume. And again, there's nothing wrong with going into retail, starting off the retail. I know everyone has different circumstances with what's going on. But I like that's just from my own standpoint. I'm very lucky that I'm very glad I did a residency, just because it's allowed me to any job that I've looked at and applied for, I've luckily have gotten. And so I definitely think my residency was able to really help me that, and at least for sure with the interview. So yeah, that's one of the things. And then it doesn't hurt just to, reach out to people who you're interested in the profession, just to ask about, like for me, for my job, that's how I kind of made the connection, with the pharmacist who had my role previously. Was I had just reached out to her on Instagram, just to, talk and then kind of build that connection beforehand. And then when a job kind of came up, was able to, reach out to her again just to see the opportunity. And it definitely helped out.
Thank you so much again. Once again, thank you for the opportunity to do an interview with you, and I wish you all the best. If our audience is interested, where can they find you?
Yeah, sure. So I've got a lot of space. So you can find me on LinkedIn as Ethan Melillo. You can follow me on TikTok or Instagram, and I'm on YouTube as well, as Millennial RX. So that's probably the best way. And especially with like questions and stuff, like dropping it in my DMs there is probably the quickest way. I will say, like sometimes it like especially with TikTok, it kind of like gets kind of crazy because everyone and their mother is asking me medication questions. But like I try my best to try to answer people, to try to get back to people. It may be a bit delayed, but that's usually like the best way to reach out to me.
All right, thank you so much. As always, hit the like if you enjoyed today's content and share this with your peers. Click the subscribe and notification bell for our latest content. Go give a follow on our social media and our guests' respective social media as well. Thank you to everyone for watching, and we'll see you next time.